Welcome to the Deep Dive. Today we're tackling a really important subject. We're looking at chapters from Rutherford's vascular surgery and endovascular therapy, specifically focusing on health and wellness for vascular surgeons.
Exactly. Yeah, it's a rich set of material, really digging into physician burnout in, well, what's obviously a very demanding field.
Right.
And our goal here is basically to pull out the key insights, what causes it, what the real impact is, and importantly, some of the solutions being explored.
And I think, while we're focusing on vascular surgeons, this whole conversation probably sheds light on pressures in lots of high-stakes jobs.
Definitely.
We're talking about these big systemic issues versus individual well-being, and some of the links might be, well, surprising.
Okay.
Okay, so let's unpack this. Let's start with the core problem. Burnout.
Okay, so burnout.
Yeah.
It isn't just feeling tired after a long week, right?
Right.
As it's defined here, it's a specific occupational phenomenon. It's got three main parts. First, emotional exhaustion, just feeling drained, completely overwhelmed.
Okay.
Second, depersonalization. That's where you might feel sort of detached, maybe cynical about your work. And third, a diminished sense of personal accomplishment, like despite everything you're doing, you feel like you're not actually achieving much.
Wow.
And what's really key here is that back in 2019, the World Health Organization officially recognized burnout in the ICD-11, the International Classification of Diseases.
That feels significant.
It was a big step, yeah. It acknowledges it's a real thing, a consequence of chronic workplace stress that hasn't been managed well. Though it's important to note, it's not classified as a medical condition itself.
Gotcha. And the numbers. The numbers really paint a picture, don't they? Especially for surgeons.
They really do. The data we have suggests burnout rates are way higher among surgeons and trainees. We're looking at something like 53% compared to maybe 26% in the general population.
53%. That's more than double.
It is. It's deeply concerning. And the personal fallout from that is, well, it's significant. It can be profoundly troubling.
Like what kind of things?
We're looking at higher risks of broken relationships, substance abuse issues, depression, and sadly, even suicidal thoughts.
Oh, wow.
Yeah, the sources point out that physicians, both men and women, actually have higher suicide rates than the general population. For men, the relative risk is estimated somewhere between 1.1 to 3.4 times higher.
Okay.
And for women physicians, it's even starker, maybe 2.5 to 5.7 times higher. Those are, frankly, alarming figures.
Absolutely alarming. And it's not just the toll on the surgeons themselves, is it? This must impact patient care, too.
Exactly. That's a crucial link the sources make. Burnout isn't just happening in a vacuum. It affects patients.
How so?
Well, there was a big meta-analysis mentioned looking at over 42,000 physicians. It found burnout is linked to a higher risk of patient safety incidents.
Okay.
Also, poorer quality of care, sometimes stemming from low professionalism and just generally lower patient satisfaction. So yeah, it's not just about doctors being tired. It suggests it kind of undermines the core of good healthcare.
And there was something specific about medical errors, too, right, that seemed particularly worrying.
Yes. There was a survey of, I think, over 7,900 surgeons. About 9% of them said they were concerned they'd made a major medical error in the last 3 months.
9% is quite a few.
It is. And the analysis showed a direct link between higher burnout scores and the likelihood of reporting these potential errors. And importantly, this connection held up even when they accounted for fatigue.
So it's not just being tired.
Exactly. It seems to be something deeper, more psychological. The analysis suggested both burnout and signs of depression were independently linked to these perceived errors. And, beyond errors, burnout is a huge driver of physicians leaving their jobs. National studies show it's a major reason doctors think about quitting or retiring early.
Which I imagine costs the healthcare system a fortune. It's not just losing one doctor.
Precisely. The cost to replace a physician is estimated at maybe 2 to 3 times their annual salary. For specialists like vascular surgeons, it's probably even higher. The text gives an estimate. Something like $4.6 billion per year, just in costs linked to turnover from burnout.
Billion with a B.
Billion with a B. And on top of that, maybe another $7,600 lost per employed physician each year just from reduced productivity.
So huge financial impact.
Massive. And that doesn't even capture the less tangible things like the hit to team morale or the overall work environment.
Okay, so burnout's a big issue across medicine.
Yeah.
But we're focusing on vascular surgery today. What makes this specialty sort of particularly vulnerable?
Yeah, unfortunately, vascular surgeons seem to be at exceptionally high risk. There was one study comparing, I think, 14 surgical specialties.
Okay.
Vascular surgeons came out with the second highest rate of burnout and the lowest level of career satisfaction.
Lowest. Wow.
Lowest. And alarmingly, about a third of them reported symptoms of depression. They also had the highest reported incidence of suicidal thoughts compared to the other surgical groups.
That's incredibly concerning.
It really is. And maybe the most striking thing, 36% said they wouldn't choose to become a surgeon again. 36%. That was the highest percentage across all those specialties.
That really speaks volumes, doesn't it?
It absolutely does. It highlights the intense pressure they must be under.
And it's not just about the surgeons working now. This must threaten the future pipeline, too.
Absolutely. High burnout, low satisfaction. That's not exactly a recruitment poster, is it?
No.
It can discourage students from even considering vascular surgery, and it makes it harder to keep the ones already practicing, which is extra worrying when you hear about projected shortages like an estimated deficit of 520 full-time vascular surgeons by 2025.
So a real workforce issue.
A major one.
Our sources also mention a specific survey, I think, from the Society for Vascular Surgery back in 2018. What did that find?
Yeah, that SVS survey involved over 2,900 vascular surgeons. It found 41% met the criteria for burnout using standard measures.
41%.
Yeah.
Still very high.
It's very high. And 37% reported depression symptoms in the past month. 8% said they'd considered suicide in the last year.
8%.
It's sobering. And when they dug into the data using multivariate analysis.
Which looks at different factors independently.
Right. It helps isolate predictors. They found age, work-related physical pain, and conflicts between work and home life were all independent predictors of burnout.
Interesting that those came out independently.
Yeah, it highlights how complex this is. It's not just one thing.
And were there differences between men and women in that survey?
There were, yeah. The overall burnout rate was actually pretty similar, around 40% for both.
Okay.
But reported suicidal thoughts in the past year were twice as high among women.
Twice as high.
Yes.
Yeah.
And women also reported more work-life conflict. Things like spending more time at home, doing electronic medical records, other non-clinical tasks. The survey also suggested that for women, predictors of burnout included not having enough family time and that work-related pain. For both men and women, though, work-related pain was an independent predictor of suicidal thoughts.
That physical pain element seems really significant then.
It really does. It underlines the multifaceted nature of these challenges, and sometimes, yeah, there are gender-specific aspects too. You can almost picture the juggling act, especially for women surgeons, maybe with family responsibilities.
Okay, so we've clearly established burnout is a huge problem, especially in vascular surgery. The crucial question then is, what can actually be done about it? The sources talk about optimizing health and wellness. Where does the responsibility lie?
Well, the text really emphasizes that burnout isn't down to just one thing. It's multifactorial. You've got issues like lack of meaning in work, just excessive workload, inefficient systems, not enough support.
Right.
Then there's trouble balancing work and life, maybe feeling a loss of control or autonomy, problems with the workplace culture or values, lack of community.
Yeah?
It's a long list.
Sounds like it.
These factors kind of fall into three big areas or domains that influence things. Two are mostly organizational, the efficiency of the practice itself, and the overall culture of wellness.
Okay, so system-level things.
Exactly. And the third is personal resilience, which often gets put on the individual physician.
Ah, right. They just be more resilient idea.
Kind of, but what's becoming clearer, and the evidence supports this, is that even really resilient doctors burn out if the system around them is broken.
So you can't just fix the person, you have to fix the environment.
Precisely. It really underscores that organizations have to take ownership of these bigger systemic issues.
And it sounds like effective strategies need to hit both levels, right? Systemic changes and individual support. It's not just telling doctors to do more yoga.
Exactly right. There's a systematic review mentioned, a meta-analysis, which basically found that both types of interventions work. Things aimed at the individual like mindfulness, stress management training, and structural changes at the organizational level like, say, duty hour rules or making workflows better. Both can reduce burnout.
So a two-pronged approach is needed.
Seems like it, yeah. For real, meaningful change.
The sources then lay out this framework from Shanafelt and colleagues. 9 key domains, I think, for shared responsibility in tackling burnout. Can you give us a quick rundown?
Sure. It's a pretty comprehensive strategy. The 9 domains are, let's see. First, acknowledge and assess the problem.
Okay. Start by admitting it's real.
Exactly. Second, harness the power of leadership. Third, develop and implement targeted work unit interventions, so specific fixes for specific teams.
Makes sense.
Fourth, cultivate community at work. Fifth, use rewards and incentives wisely. Sixth, align values and strengthen culture.
Culture seems key.
Hugely important. Seventh, promote flexibility and work-life integration. Eighth, provide resources for resilience and self-care. That's the individual support piece.
Right.
And ninth, facilitate and fund organizational science, basically. Keep studying this stuff. Each one plays a role in creating a healthier work environment.
Okay, let's maybe dig into a few of those key strategies a bit more. The first one, acknowledge, accept, and measure the problem. Why is that step one?
Well, it really sets the stage for everything else. If the leadership openly says, yes, burnout is an issue here, and we're committed to addressing it, that builds trust.
Right, you need buy-in from the top.
Absolutely. And just like organizations track patient numbers or safety metrics, the argument is they should also be tracking physician well-being, probably at the level of specific departments or work units.
So, data-driven wellness.
Kinda, yeah. That data then helps figure out where to focus efforts, where to put resources. They mention tools like the Maslach Burnout Inventory, the MBI.
What does that measure?
It looks at those 3 core dimensions we talked about: emotional exhaustion, depersonalization, and personal accomplishment. It gives you actual data on the scope and nature of the problem.
Okay, the second domain was about leadership. How much impact does a direct supervisor actually have?
A huge impact, according to the text. There's data from a 2013 survey showing a really clear link. Higher leadership scores from your immediate boss correlated directly with less emotional exhaustion, less depersonalization, and higher job satisfaction for the physicians.
Really? Direct correlation?
Yeah. And apparently, even a small increase in the leader score, like just 1 point, made a significant difference. Lower likelihood of burnout, higher satisfaction.
Wow.
So good leaders seem to understand what makes their team tick. They can help align work with people's sense of purpose. The text really stresses selecting leaders carefully, developing their skills, and actually assessing how effective they are.
And making changes if they're not effective.
Right. Even suggesting that if leaders consistently get low scores despite support, maybe changes are needed.
Okay, so after assessing the problem and getting leadership on board, the next step was targeted interventions. What does that look like practically?
So you use the wellness data you collected to find the specific areas, maybe certain departments or teams where burnout is highest. They call these high opportunity work units.
Right, where you can make the biggest difference.
Exactly. Then maybe a leadership consulting team works with the leaders and doctors in that unit to figure out the specific drivers of burnout for them.
Because it might be different from unit to unit.
Could be, yeah. Based on that understanding, they work together to create and roll out tailored fixes for those specific issues. The whole idea is to shift the mindset, move doctors from feeling like victims of the system to being active partners in fixing their own work environment.
Engaging them in the solution.
Precisely.
Another domain was cultivating community at work. How important is that peer connection?
Incredibly important, it seems. Formal peer support, informal chats. They're really valuable for doctors dealing with the unique stresses of the job.
But probably harder to come by with busy schedules.
That's the problem. Increased workloads, admin tasks, they can lead to more isolation. But there was a really interesting Mayo Clinic study mentioned.
Yeah.
They found that just giving doctors protected time, like 1 hour twice a month, to meet in small groups and just talk about their experiences, that led to a significant improvement in their sense of meaning in work and less overall burnout.
Just from talking to colleagues regularly.
Seems so. They also talk about second victim syndrome.
What's that?
That's the psychological trauma healthcare providers can go through if they're involved in a bad patient outcome, even if it wasn't their fault.
Ah, right, the emotional toll.
Exactly. And having rapid response peer support teams, people who can quickly connect with those clinicians after an event like that, can provide crucial understanding, empathy, help them process it, and hopefully return to work more resiliently.
That sounds vital. Okay, moving on. Rewards and incentives. How do they play into burnout?
Well, the text warns about relying too heavily on pure productivity-based pay.
Why is that?
Because it might unintentionally encourage behaviors that could hurt patient care or increase burnout, like rushing through appointments or just working crazy long hours to hit targets.
Right, perverse incentives.
Yeah, kind of. So exploring other models might be better. Maybe mostly salary-based pay or having individualized incentives that actually promote better work-life balance or give protected time for other meaningful work besides just seeing patients.
Thinking more broadly about rewards.
Exactly.
And then there's aligning values and strengthening culture. That sounds
That
fundamental.
really is. The organization's underlying culture, its stated values, these are foundational for how physicians feel about their work. The text stresses that organizations need to be really aware of what shapes their culture, look at their values regularly, and make sure their actual practices line up.
Walking the talk.
Basically, yes. Especially in academic medicine, where you might have medical schools merging with big health systems, they need to make sure that core academic mission doesn't get lost. And with the shift towards team-based care, it's crucial to build a culture of, equity, diversity, inclusion, where everyone on the team feels respected and valued.
So what makes for a healthy culture?
Key things mentioned include strong physician leadership at all levels, fair compensation, real partnerships between doctors and administrators, a truly team-based approach to care, and policies that actually encourage doctors to stay long-term, reducing that costly turnover.
Okay. Work-life integration came up several times. That seems like a huge one for doctors.
It's a massive contributor to burnout, yeah. Physicians generally report much lower satisfaction with work-life integration compared to other professionals.
Just because of the hours and demands?
Largely, yeah. The unpredictable nature, the long hours. And this can hit women physicians particularly hard. Even now, society often expects women to carry more of the domestic and parenting load.
Right.
The text cites data showing way more women surgeons with kids feel like child-rearing slowed their career down compared to their male colleagues.
So what can organizations do to help with flexibility and integration?
A range of things, really. Offering more flexible scheduling where possible, providing different leave options for family needs, maybe having on-site or subsidized childcare, and importantly, fostering a culture where teamwork is valued and leaders are actually held accountable for creating a supportive environment, showing compassion when those work-life conflicts inevitably pop up.
So real practical support.
Yes.
And finally, the last domain we'll dig into, providing resources for resilience and self-care. How do these individual tools fit in?
They're important, but they have to be seen as part of the bigger picture. Addressing the systemic stuff is paramount for lasting change.
Right. Can't just be on the individual.
No. But providing accessible resources to boost individual resilience and self-care can be a really valuable complement to those bigger organizational efforts.
What kind of resources?
Well, the text notes that even relatively small investments in both organizational and individual support have shown results in reducing burnout. They mention resilience training programs, like the one the U.S. Army uses, Ready and Resilient, which focuses on skills like self-awareness, self-regulation, optimism, mental agility.
Interesting.
And there's also growing evidence for professional coaching. One pilot study showed that even a fairly brief coaching program led to significantly less emotional exhaustion and better quality of life and resilience for the doctors involved.
So coaching can make a difference.
It seems so. But again, the key takeaway is that these individual resources work best when they're offered in a place that's also genuinely trying to fix the underlying system problems driving burnout in the first place.
Makes sense. You need both.
Exactly.
The deep dive also mentioned some specific challenges within vascular surgery itself, ergonomics, and training stress. Can you touch on those briefly?
Sure. Yeah, vascular surgeons have really high rates of work-related musculoskeletal pain. It's just a physically demanding job, whether it's traditional open surgery or the newer endovascular stuff.
All that standing, awkward position.
Right, and that chronic pain can really cut careers short and definitely adds to burnout. So good ergonomic strategies are crucial exercise, posture awareness, taking micro breaks, having adjustable equipment.
Looking after their bodies.
Absolutely. And then there's the training period. Vascular trainees also report high levels of distress. There are things that can be modified, though, the learning environment, the quality of mentorship they get, teaching better coping strategies.
So improving the residency experience.
Yes. There's a big trial mentioned, the second trial, that's looking specifically at this. It focuses on things like faculty-resident relationships, building camaraderie among residents, and tackling mistreatment.
Is mistreatment still a big problem?
Unfortunately, yes. Surveys show high rates reported by general surgery residents, things like public humiliation, discrimination, verbal abuse, and that mistreatment is linked directly to higher burnout and suicidal thoughts.
That's awful.
It is. So the second trial aims to benchmark trainee wellness and figure out interventions to make training healthier and more supportive.
Okay, so wrapping this all up,
Yeah.
It's incredibly clear that burnout is a major complex issue in vascular surgery. It has really serious consequences, not just for the surgeon's well-being, but for patients and the whole healthcare system.
Absolutely.
And tackling it requires this comprehensive approach, changing the organizations and the systems and providing support for the individuals.
Exactly. There's no magic bullet here. It really needs a fundamental shift towards creating a healthier, more supportive, and just more sustainable way for these incredibly skilled, dedicated people to do their jobs.
And that leads us perfectly into our final thought for you, our listener. Given these really clear links between how doctors are doing and the quality of care we all receive, how can we maybe take these insights and apply them elsewhere? How do we foster healthier work environments in other demanding fields? What role does our own individual responsibility play in pushing for those bigger systemic changes? And maybe just thinking personally, did any of the systemic issues we talked about today, the workload, the culture, the work-life juggle, did any of that resonate with your own experiences in your work life? Definitely something to mull over. Thank you for joining us for this deep dive.